According to the CDC, nearly 2/5 of all U.S. adults are obese, and the number continues to rise. Illinois has a problem with overweightness and obesity among its adults as well. Local governments, with the help of supporters, should enact policies and initiatives that promote healthy lifestyles for the citizens by taxing sugar-sweetened beverages. Illinois, and Peoria County specifically, are record high numbers for obesity, with additionally substantially high numbers for people who are overweight. Managing health and weight is important for the personal safety of all citizens. I live in Illinois and I've lived with and been around many overweight people all my life. I've seen firsthand how harmful these lifestyles can be, so I want to be more focused on fixing this problem. To give you a preview, obesity rates are the highest they've ever been, and they have repeatedly been increasing over the years. Local government agencies should enact a policy that taxes sugary beverages to encourage consumption of healthier alternatives. Many states have decreased the obesity rates by updating nutrition and physical education standards in school. Policies similar ones that I'm proposing have been successful in reducing the obesity rates, whether it be from making healthier food more available or to food retailers and grocery stores, or having better physical education or other policies. To make a difference, you can contact your local government officials about creating a healthier community with this policy and encouraging others to do the same. Now that I've covered the basics and the introduction, let's get on to how big the problem of obesity really is. The weight gain affects a large portion of residents. Some think it's only small, but it's really the vast majority. There are about 12.5 million people in Illinois, and about 65% of them are overweight or obese. That is about 8 million people that deal with weight problems. That's a huge thing. This was given to me by the CDC. In the last 3 decades, the adult obesity rate in Illinois has risen about 20% from 10.9% to 31.6%. Peoria County has an obesity rate about 5% higher than Illinois as a whole. This is found in an article written by the CDC. The problem with obesity and overweightness isn't just limited to a small portion like how a lot of people think. It affects the vast majority of them. Next, we cover the childhood and adolescent obesity being on the rise. Adolescent obesity in Illinois has risen about 3.5% in the last decade, bringing it to up to just 15%, and the overweight rate sits about the same as well. Children, not just adolescents, have shown very similar statistics to this when it comes to their rates. This is shown from a report from the Illinois Obesity and Weight Status. About 1 in every 3 kids in Illinois are affected by obesity and overweightness. That is a huge percentage of them. As the rate continues to increase and the number of families and people that suffer from weight gain grows, the problem only gets more severe. Next, we cover how conditions and the costs accompanied with weight gain are also great. Adults with obesity have a higher chance of developing serious health conditions like heart disease, type 2 diabetes, types of cancers, strokes, some mental illnesses, and an overall decreased quality of life from various factors. This is from an article about obesity in Illinois. All the conditions associated with obesity make the disease very costly. From related illnesses costs directly from the obesity itself, it's estimated that obesity nationally costs about $147 billion each year. This is also a report from the CDC. The health of adults in Illinois should be a main concern for everyone, and the cost that the disease brings for the state is severe as well. Now that I've covered the problem, let me show you a solution that I found. My policy is to tax sugar-sweetened beverages to decrease consumption that can lead to obesity, especially in adolescents. Taxing sugar-sweetened beverages will force consumers to pay more for their unhealthy drinks, help them resist the temptation of purchasing them, and create additional tax revenue for the state. This is shown by a study from Colleen Wynn. Taxing beverages based on the severity of the sugar content can guide people towards healthier and less expensive drinks. The more sugary drinks will have higher taxation rates, while the less sugary drinks will be even cheaper. When purchasing more expensive drinks, the consumer is confronted with the choice of purchasing it and having to face obesity and weight gain, so they will have to make a conscious decision to go through with the purchase. This is shown by a study from Fox and Horowitz. Lower income communities and families purchase much more sugary drinks than higher income communities, so increasing the price of the thing they purchase the most will make most people purchase cheaper, healthier alternatives. Despite this, some people who are already have low on money will continue to purchase the more expensive drinks. By putting less tax on healthier drinks and incentivizing these options, they will always have choices that are cheaper and better for them. With the basics of the solution out of the way, let me show you how it can help out your community. The weight problem in Illinois could get better for everybody with a bigger effort put into it, and it could keep on keeping the state healthy and have the weight gain under control for the future. If the solution is adopted, healthier and less sugar drinks will most likely be more accessible than unhealthy drinks, as the cost for purchasing and stocking them will be cheaper. This is also a study from a report from Creekweed. Tax money from the policy can be dedicated towards obesity prevention for the state to use. With the extra money, the state has opportunities to create their own policies to keep the obesity rate down in the state. Because of the tax, even if someone purchases a sugary drink that is bad for them, their money is going towards helping themselves and others that may be overweight as well. Obesity rates could go down, and the state may be able to reverse some of the effects of the disease's cause. Even a slight decrease in obesity and overweight rates could save the state a lot of money because of how much they spend medically. That money, similar to tax money, can be used to promote even more healthier eating and active lifestyles and habits through the other programs in the future. This is shown from a report from Overweight and Obesity. Now that you know about my policy, the next step is making it reality. I ask you to contact your local representatives in Peoria to look into these solutions and take the matter of obesity into serious consideration. Similar policies regarding the plan that I've come up with have already been enacted and all around the U.S. and around the world. From San Francisco, New York City, Seattle, even Cook County, taxes on sugar-sweetened beverages have been implemented with positive outcomes. This is shown from a report about healthy communities. Out of all the different obesity prevention policies, this one is by far the most popular, right, in the moment. So, with this increased momentum and popularity, it has a much higher chance of being accepted and used in Peoria. And this is shown from a report by Colley and Wen. Now that we have discussed the policy and its benefits, let's look at the big picture again. There's a great obesity problem in Illinois in the United States, and Peoria County is not excluded from that. By taxing sugar-sweetened beverages, the obesity rate could go down, people could start living healthier lives. Similar policies have been used across the country and the world, so by following in their steps, we could decrease our obesity rates as well. The best way to see change in the area is by contacting your local Peoria representatives and asking them to be informed on the topic and treat it as a real problem like it is. To conclude, obesity puts a lot of people at a much greater risk from most of the medical complications that are part of the leading cause of death in the United States. With a great majority of people being overweight or obese, susceptible to these conditions, it is time we treat this disease as a serious concern rather than just a societal norm. Thank you.